Hello coders, welcome to our channel. Do you know what is the difference between enteroscopy and EGD? If you know the answer, please mention in the comment section of this video. If you don't know the answer, please watch this video until the end. So whenever we want to learn endoscopy procedure in the digestive system, we need to know the anatomy first. So digestive system divides into two parts, small intestine as well as large intestine. So the other name for small intestine is small bowel. The other name for large intestine is large bowel. Small intestine consists of duodenum, jejunum and ileum. And large intestine consists of anus through cecum. So mostly in today's video we are going to learn about small intestine and how to code if the physician crosses second part of the duodenum. In CPT coding, most of the time we will encounter EGDs. The other name for EGD is esophagogastroduodenoscopy, where physician will examine esophagus, stomach and second part of duodenum. Then we will call it as EGD. So then what is enteroscopy? So if the physician crosses the second part of the duodenum, we will call it as enteroscopy, where physician crosses duodenum and he will enter into jejunum, as jejunum is the second part of small intestine. For EGD coding, we will use 432-3 series of CPT codes, where physician will examine esophagus area, stomach area and duodenum area, or he will reach until second part of the duodenum. Then how do you code if the physician crosses second part of the duodenum? There we need to use 44360 series of CPT codes. These codes usually we will call it as enteroscopy CPT codes. So whenever we want to code EGD as well as enteroscopy, we need to check the intent of the procedure. Why physician wants to perform EGD or enteroscopy? Basically intent means purpose. What is the purpose of endoscopic examination? For example, if the physician wants to examine up to second part of the duodenum, so we will use 432-3 series of CPT codes. If the physician wants to examine beyond second part of the duodenum, including jejunum, then we need to use 44360 to 44373 series of CPT codes. So sometimes what happens, physician wants to perform the EGD, but if the patient is having any type of previous surgery, during the EGD, physician will cross the second part of the duodenum and he will reach jejunum. In this scenario, we will not code enteroscopy CPT codes, as the intent of this procedure is to examine the up to duodenum. We will code only EGD CPT codes. So in the documentation, if you see, if the physician mentions I have crossed the second part of the duodenum and I have reached jejunum, means directly you can't code enteroscopy CPT codes. We need to check intent of the procedure. Why physician is performing this procedure? If the physician's intent is to examine only up to duodenum, you will use 432-3-5 series of codes. If you are unable to find intent of the procedure during the gastrointestinal EGD or enteroscopy, we need to query the physician regarding the intent of the procedure. So if anyone looking for same day surgery training, SCC training, IPDRG training, please send WhatsApp message to or please call 707-526-3939 for immediate action. And also again, if you want to code enteroscopy, in enteroscopy also we are having two sets of codes. 44360 to 44373 does not include ileum, where physician will perform up to jejunum. And next set 44376 to 44379, where physician will examine jejunum along with ileum. So what is the most important thing here? Whenever you want to code enteroscopy, we need to check whether physician has examined ileum or not. Why means we are having separate set of codes including ileum and without ileum. So most importantly, whenever you want to code enteroscopy codes, must and should you need to check intent of the procedure. So here I am concluding my session. So if you are having any doubts, please mention in the comment section of this video.